I am Dr. Sangeeta, reproductive medicine specialist, laparoscopic surgeon, and I am into cosmetic gynecology, practicing since 20 years in Coral Advanced Fertility, New Bell Road, Bangalore. Fertility counseling, it's all about individual or a couple who want to talk freely or openly about the problems they face or about their experiences or about the expectations or the grief they have to face during the journey prior to parenthood. So, it can involve so many issues, including psychological issues. So, it's very important for a couple to consult the consultant or a counselor whenever they face any problem related to fertility or during their intimate sessions. So, who can give the fertility counseling sessions? So, consultants like doctors, or gynecologists, psychologists, or reproductive specialists hire specialized consultants who are like trained to counsel problems of these couple. So, when we just counsel a patient regarding their fertility issues, we have to know completely about them, their lifestyle, their expectations, and what are their problems. So, what are the problems they face? So, sometimes we have seen patients who could not consummate even after 3 to 4 years, 5 to 6 years of staying together. They will not be having any feelings. Such patients definitely require a counseling from a specialist like a sexual psychologist or some specialist to just make them understand that there is no problem, and most of the cases it is psychogenic, and simple lifestyle modifications and counseling will help them. When we come to other problems like they face during their intercourse, like the female will be having problem, female will have pain, she will have burning sensation, irritation, anxiety, especially during the first few months, and then she might be having infection of the urinary tract or the vaginal infection. So all these things she will be suffering sometimes silently, and she has to, or the partner has to make sure that they consult a specialist. And because for everything there is a treatment, we don't have to suffer in this era where there is treatment for everything. So simple things like anxiety related, burning sensation, irritability, and all those things can be treated. And sometimes there will be pathological problems like a very tight introitus or congenital anomalies. There can be dysgenesis, or there will be what we call as like vaginal constriction at the introitus. There can be septum which will be causing a problem during intercourse, and such things will have to be dealt with by the gynecologist with surgery. And sometimes there will be infection, she'll be having white discharge, purulent we call when it is yellowish or greenish in color. There will be irritation, there will be burning sensation, there will be slight bleeding whenever they have intercourse. So all these things they have to consult, and we can take care during the fertility counseling time. And men, on the other hand, will be having problems related to erectile dysfunction or ejaculatory problems. So all these things, some majority of the times it will be psychological, or it can be corrected with simple medicines. Sometimes it will be pathological, which requires complex treatment along with counseling. And when we come to fertility problems, like apart from intercourse or sexual problems, we face like they are unable to conceive. Even after 1 year of trying without any contraception, if they have tried for 1 year and they haven't conceived, they have to again report back to the consultant where we do evaluation of the male. Then we see to that the female is ovulating, her hormone levels are fine, her ultrasound is fine, and we just, and all other conditions will be excluded like diabetes, thyroid, or hypertension, which can be treated. And we take into account the complete medical, surgical, and family history before treating her. And after that, we'll be telling her what is the safe period, when she has to try, when is the fertile period, and all those things, and we can have a timed intercourse. Because of ultrasound we can definitely tell when they have to have the intercourse, so we can predict ovulation accurately. And even in men, we can treat them for mild disorders of semen, like the motility of the sperm, the count or sperm count in the semen, or the normal sperms. All these things, there are so many disorders because of our lifestyle or because of occupation, like increased temperature, where they will be working in a condition where there is increased temperature, and chemical exposure, radiotherapy, or there will be infection in the testis, or there will be tumor in the testis, or any tumors in the brain which can affect the hormones related to gonads, and any other systemic disorders, along with the medications used, like some medications used for hypertension or psychological disorders or any other disorders might affect the production of sperm. So there are so many disorders causing abnormal semen parameters, and all these things we can come to know just with history. Minimal tests required, and the basic test is the semen analysis. We just know the sperm count, sperm motility. Again, motility, we have rapid progressive motility, slow progressive motility, non-progressive motility, and dead sperms, which we tell non-motile sperms. Along with that, normal sperms, we have a certain criteria to tell the sperm that it is normal. It is based on the shape of the head, neck, and middle piece or tail. It has to comply with the criteria. Then we call it as normal sperm. So there are minimum criteria, like so many 15 million sperms should be present in an ml, and 34% should be motile, and all those things we'll have to take into consideration. Then if there is any abnormality, we try to find out the cause based on, as I already said, the history, investigations, and other things. And the treatment again depends on what is the cause. Majority of the male fertility disorders, it can be treated again with simple dietary and lifestyle modifications, like they should not keep the phone in their pockets, the laptops on their thighs, and they should not keep sitting at a place for 8 to 10 hours, because all these things increase the temperature of the scrotal sac, that is the testis, and high temperature is very detrimental to the sperms. So we just tell them you have to just take a walk, maintain good health, and try to avoid increased temperature of the scrotal sac for any reason. It can be continuous sitting, continuous driving, or working in hot air furnaces, or the chefs working in front of the fire always. And all these things they have to take care, along with other therapies, like we just advise them about the cold water therapy, or we give them some medications, we check for the infections and hormone profile. Even if it is sometimes zero sperms, it is due to the block of the ducts connecting to the outside. So sometimes we can still retrieve from the testis and give them their own baby, and they don't have to worry too much. But only in cases of complete failure of the testis, that means there are no sperms even in the testis, even if we do micro-PSA or PSA, then that patient might require donor sperms for them to conceive. In cases of female fertility problems, as I said, we take their history, we after examination, we do a scan, and we do hormone tests, we do other related investigations to know her general health, and we start assessing her for ovulatory function. If she's ovulating, we advise them timed intercourse. If she's non-ovulatory, we just induce, we do ovulation induction, and again monitor through ultrasound, and then advise them when she's going to ovulate, and they should have a timed intercourse during that time without fail. Then if they are failing to conceive, we'll have to evaluate further. We do diagnostic hysteroscopy, laparoscopy, followed by again ovulation induction. Then we go for insemination, and if she doesn't conceive after several attempts of these things, that is 3 to 6 cycles, we go for in vitro fertilization, that is IVF treatment.